Hey there, sports psych enthusiasts. I'm Dr. Colin Fehr, and I want to share my passion with you. I love talking about ways to unleash the power of the mind. This recording is part of a larger lecture series I've created in an effort to make sports psychology concepts more accessible to a larger audience. The information contained in this series is especially well suited for students of sports psychology and is presented in a way that makes for easy listening for all. Welcome to Sports Psych Concepts.
All right, everybody. Hope everything's going well in your world. Thanks for joining me for this sports psychology presentation. I want to talk specifically about different interventions that practitioners can use for athletes who are going through the rehab process after they sustain an injury. Because again, injuries are really common. Athletes experience this, and it can have a negative consequences or impact. It can change the athlete's way of life, all of those different things. And so if we're not addressing the psychological part of their experience during rehab, then we are missing a key component of their experience, because those psychological things are it's a key part of the experience. And so we want to make sure we're addressing that because it plays into the rehabilitation. I mean, it plays into the injury itself, but then of course the rehabilitation. And so if we want to create a holistic rehabilitation process, then we want to be a part of that. Okay, so in this presentation, I'm going to give you some general ideas to consider, and then I'm going to talk more specifically about a couple of interventions. So it's certainly not all encompassing. Much more could be said. There's a much lengthier list on the types of interventions that could be employed. So just keep that in mind as you listen to what I have to say. Now, just to introduce a few more ideas before we jump into those things, I want to reiterate this idea that there's no standard approach. So as I was saying, there's many different interventions that are out there, and some of them have been basically validated in the literature, and others maybe we would refer to them as more evidence-informed approaches, and so there's a range of different types of things, but there's no standard approach. Okay, so you can go and read one study on how a particular approach or intervention was designed and done successfully, and then you can go and read a different study that maybe it was a similar sort of overall concept, but the intervention itself was different, and the setting was different, and the athletes were different, and so the way it was put together doesn't exactly align with the other approach. Okay, so that's really important to understand, because if for practitioners listening to this or future practitioners, there's not a cookie cutter approach. There's not a one size fits all on how we put this together. And so we can pull from all of the different interventions and types of things that are there, but really we're tailoring everything that it is that we're doing to the situation, to the group of athletes, or the individual athlete. Everything that we're doing is a custom approach. So keep that in mind as I mention some of these specific approaches, because they're not really standardized. Maybe there's a framework and there's principles and guidelines to use, but it's up to you as a practitioner to then customize that to the situation. So a few general examples that we could talk about here, and again, this isn't exhaustive, but just types of programs that you could build include things like solution-focused counseling or therapy is the theory behind this, right? Or cognitive behavioral work, or acceptance and commitment therapy, or different mindfulness things and imagery. Okay, and I'll talk about mindfulness and imagery more specifically in a moment. Okay, but these are just some examples. Okay, so you have a lot to choose from. So I think about solution-focused approaches, to where really we're not interested so much in the problem, like making space for the athlete to talk about the problem, and they can't believe the injury happened to them, and they don't know what they're going to do with their life, and they're so depressed and all those sorts of things. And it doesn't mean that those things aren't important to pay attention to and acknowledge and all of that. It's just solution focused. The emphasis isn't so much on those things. It's more on, okay, well, what is the solution? What can we do? What are we going to do right now? And so an example intervention would be scaling, which is something that I like to use because it's so simple and practical, but it's just, scale of 1 to 10. All right. Well, where are you at right now on a scale of 1 to 10 with your confidence or your motivation or whatever psychological thing? You could even use this for like your injury recovery. Okay. So if a 1 is like, man, the injury just happened, and a 10 is you're injury free, you're pain free, you're back to where you were before, where are you at right now? And so then they will give you whatever their number is. Say they say a 4, and you say, okay, well, what do we need to do? What's the one thing that we can do right now, today, to move you closer to a 5? You're at a 4. How do we get to a 4.5? How do we get to a 5? And you build the conversation around that, and that's what they talk about. They talk about solution, and they help generate the solution. Can be a really powerful approach. Okay, so just a small example from that theoretical orientation. We also could use cognitive behavioral techniques, just getting them thinking about their goals. You could use decisional balance things there, pros and cons of the situation, right? Or goal setting is classic, and in this sort of instance, it would be goal adjustment for some goals that they had set previously, but then setting new goals based on their rehab. So that's a cognitive behavioral approach where you're just getting them thinking about different things, and so then their thoughts are going to drive their behaviors, is the idea with that. And then we can use things like acceptance and commitment therapy concepts or principles. There's kind of 6 core principles from ACT or ACT, and one of them is diffusion, which basically is just helping them understand that they aren't their thoughts. They have their thoughts, and they're there in their mind, and they're just words. They're just things. They don't have to relate to them. They don't have to interact with them. They don't have to accept them or believe them. And that's what diffusion is all about, is getting them to separate themselves from their thoughts and just acknowledge them. It's just as if they're just words on a paper or screen, and they can choose how they relate to those things. Okay, so some specific examples on that, but again, so much more could be said about these frames of thought. I'm just sharing them here to expose you to them and introduce you to them. And so if you're interested in those things, those concepts, encourage you to do more digging and more reading. But I'll share a little bit more about some other specific approaches. And the first one is imagery. Okay, imagery is this sort of multi-sensorial creation of an experience in the mind. Okay, you're building something in your mind, images of things, experiences of things. We call it imagery, but really it's much more than that. Sometimes you hear the term visualization described as this, and it really doesn't capture all of it if we're just focusing on the vision component, because we want to bring in the other senses, the smell, the taste, the sound, right? The sensing, the tactile sensing of the experience. That's what imagery is all about. So we're using those senses to create a certain experience. And we want it to be as close to the actual experience, or how we would perceive the actual experience, as possible. Okay, now imagery is a widely used psychological skill by athletes, especially those undergoing injury rehabilitation. It's a very specific skill that can be employed with great success. I've created and recorded imagery scripts for athletes that specifically target their rehab process and what they're going through, and build some powerful images in their mind. I mean, they help me create the script and the ideas and the things they want to see in their mind, but can be really, really powerful. And there's lots of different benefits here. Things like reducing anxiety. It can improve their sense of self-efficacy or their confidence, decrease or alter how they're experiencing pain or perceiving pain, and just aiding in their overall recovery and adherence. And it even could be like maintaining sport-specific skills. If they're not able to practice they're physically because they're injured, they can get a lot of reps in their mind. And there's some interesting examples out there online that you can read about. You can look up the story of Ben Hogan and how he spent all this time in the hospital after a car wreck, and where he kind of sacrificed himself for his wife, and how he spent all that time in the hospital, and he was using imagery consistently, and he came back in a ridiculously short period of time to win one of the major golf tournaments. Okay, so other examples that you can think about for this, but imagery is a core intervention. That's why I'm going into more detail with it here. It's a core intervention to use with athletes who are recovering from injury. Okay, so the specific framework that I'm going to share with you is called the PETLEP model, and PETLEP is an acronym, so P-E-T-T-L-E-P, PETLEP. And this is a model that it gives you a practical framework for how to apply imagery. So the acronym, the letters in the acronym, which I'll go through each of these individually, the model emphasizes how important it is to incorporate these 7 elements of the acronym to make the imagery as functionally equivalent as possible to the actual experience. So we want that to match up as much as we can. That's the idea. Okay, so I'm going to go through each of these letters in the acronym and walk through these things, but I will say, if you're interested in learning more about the model, this is from Holmes and Collins, and there's different articles that have come out subsequently and examples of how to implement this. So you can go and you can search for the PETLEP model or PETLEP framework in the literature, and you can find some different examples that will describe this also in detail and also show how this can be implemented in practice. Okay, so I want to go through each of the letters in the acronym just to talk through these things, because when we're creating an imagery script or an imagery recording, these are the things that we want to keep in mind. These are the things that we want to address and include intentionally. Okay, so we have to have an intentionality in how we're going about that. So the first P, right, is physical, and the idea here is that the imagery needs to include as similar physical sensations as possible to the actual task. So an example that I've used with tennis players before is to get them to actually feel the felt of the tennis ball and maybe even the lettering and the seams that are on there. You could use it with basketball players as well, or soccer players feeling the soccer ball on their foot, right, and in contact with their shoe and all these things. But we want it to include those physical sensations. We want a kinesthetic component as much as possible, and so we want to describe those things and be able to describe those things. So if it's a sport that we're not as familiar with, we want to enlist the help of the athletes to come up with those descriptions. Okay, so the first P is physical, those physical sensations. Then we have E, which is the next letter, which is environment. So essentially here, the context needs to resemble the performance environment. And there's different ways that you can do this, but you want it, like if you have a basketball team and they're getting ready to go and compete in a conference championship or regionals or even nationals, you don't want to have them practice imagery that's in their home gym of where they compete all the time. You want to take them to the place of where they're going to compete, and which means that as you as a practitioner, you need to look up pictures, maybe try and find some videos, and try and create this image in their mind that matches that. Okay, there's another way that you can address this, and I've done this with cross-country athletes before, is so maybe the day before the meet, they'll have a course preview, and so they go and they kind of run the course, and then they kind of visualize a couple things, do some strides and all of that. But you can then take them off to the side away from where other runners are and other distractions and noises, and have them sit or lay down in the grass and do an imagery experience right there where they're actually at the environment where they're going to compete and perform the next day. Can be a really powerful tool with that. Okay, so that's environment. So we have P, physical, E, environment, then T, the first T is the task. Now the idea here is that the task just needs to match whatever the skill is that they're being performed. So again, if you're working with athletes in a sport that you're not as familiar with, the task requirements, you want to have the athlete help you come up with that description. So I've worked with some hockey athletes, and I don't have a lot of experience with hockey myself. Certainly not with skates on my feet. And so I don't know how to describe how to execute a slap shot. I don't know how to, or checking somebody, right, or different sensations of skating. And so I need the help of the athlete to describe what that task is like to make sure that I'm matching what it is that the skill actually requires. Okay, so we have P, physical, E, environment, T, task. The second T is timing. Timing, basically you have two options. You can create an imagery experience that is in real time, or it is in slow motion where you kind of have this time distortion, or maybe you can even speed it up. You play around with those different things. Now, in general, you want it to be as much in real time as possible. But if you think about, the length of an entire football game or basketball game or certain sports, or again, even like cross country athletes where I've done imagery for them, their race can last 15 to 20 minutes depending on what level and how fast they are, and so the timing, you're not going to have them sit there and visualize or image in their mind every single part of the competition. And so there's ways that you can create the script to where you kind of you step in and you see the beginning part, and then you're out there and running, and you just have these general parts of the competition. If it's cross country, right, it could be basketball, different parts of the competition. You could have them visualize the last 2 minutes of a really close game, or seeing themselves shoot free throws, clutch free throws, things like that, right? So the timing component, you want to figure out what part of the competition you're really trying to capture, and make as much of it real time as you can. Okay, so that's the second T. So we have P, physical, E, environment, T, task, T for timing, and then L, which is for learning. Okay, so ultimately the imagery should adapt as the athlete learns and they progresses and they get better. So the important thing here is, because I've created some scripts for athletes, and they'll use them for quite a long period of time, but eventually it's like they're going to outgrow them, as they get better and they move beyond, and now they've sort of mastered what it is you were trying to master. And so then we need to adapt that. I need to create a new script. I need to record another script for them so then they can continue to progress. So that's what that one's all about. Okay, so P-E-T-T-L, the L was learning. Then we have two letters remaining, E and P. So the second E is emotion. And this can be really powerful. The emotions are what can tie in the whole experience. Okay, so you bring in these powerful emotions, you see themselves succeeding, feel themselves experiencing it, and the feelings that come to mind for them, and feeling strong and powerful and confident. And you tie all of that in, and that really cements it and brings the whole thing together. Okay, so including those emotions is a really, really powerful approach, and definitely something that you want to do. Okay, and so, which are the last letters? So we had P, physical, E, environment, T for task, T for timing, L for learning, E for emotion, and then the last P, pet lep, is perspective. Okay, and this one, you want to, so perspective refers to either you're doing first person, sort of internal, like role playing game sort of thing, RPG thing, or external third person perspective. So they're outside of themselves and they're watching themselves perform. So to determine what to do on this is you need to ask the athlete, what do they prefer? Do they want to see themselves competing? How do they already image and visualize in their own mind? How do they see themselves? Is it through the first person, or is it through third person? Okay, and so you want to tailor that based on what their preferences are. And maybe they don't know, and so maybe you do a little exercise with them and try both of them out and then see what they prefer. But that's what you want to consider with that. Okay, so that is the PET-LEP framework. A lot more could be said about it, but you include those 7 primary elements in the scripts and recordings that you're putting together, and you increase the chances that you have a really effective imagery experience for your athlete. Okay, so now to extend the imagery idea just a little bit further, there's another model or perspective of things to consider here, and so I'm just sharing this again to broaden the understanding of how we can use the imagery and what sorts of things that we should consider. And I do want to mention, because I didn't give a lot of specific examples in the PET-LEP framework going over that, in how you can use that in relation to injured athletes, but there hopefully you can make some of those connections in your own mind, because there is so much there that working with injured athletes and creating those things and the physical task, the sensation of what it is that they want. And I do want to share one example really quickly in relation to that, because when I was a collegiate athlete and I had a significant injury, I actually had a hard time coming up with the images myself of what it felt like to be healthy, to not hurt, to not have that pain. And so the sports psychologist that I worked with, he actually had me go back even farther in time to when I was a younger athlete, because I didn't have recent memory of what it felt like. And I'm trying to image things of what it felt like, and I didn't have it just everything hurt recently. And so I had to go way back in time to actually reassociate myself with what it felt like, the physical sensations, the task dimensions of not being hurt as an athlete. Okay, and so sometimes that can be something worth including, is just how far back do you have to go, because athletes can struggle with that. Okay, so I just wanted to mention that real quick, but I have this other model. This is from Williams and colleagues. You can go and read this up as the 5 W's of imagery. So again, just something we can use as we're planning imagery and we're creating those scripts. We can structure our guidelines using these 5 W's, and the 5 W's are who, where, when, what, and why. Okay, so who considers the individual athlete's imagery ability and their personal preferences. So we definitely need to keep that in mind, because some athletes, their imagery skill is not very well developed in terms of their ability to control their images or how vivid they can make their images. Okay, that vividness and controllability. So we have to take that into consideration, and how that might tie in, right? And so maybe they only are going to be good for a 5-minute imagery script. 10 minutes is going to be too long because they don't have the skill to be able to do that. Okay, so we also need to consider their personal preferences. So who, and then where is the imagery going to be practiced? That can vary. So you want to ask athletes. I've asked them before. I've created scripts and say, well, where are you going to do this? Are you going to do it in your dorm room? Do you have other places that you can do this? There's somewhere in the athletic complex where you can find a quiet place. Like, where are you going to do this? So that's important for me to understand, and how I create it for you. Okay, are you going to be sitting, or are you going to be laying down? That matters. Okay, so who, where, and then when is, if we're talking about rehabilitation, where is it during the process, or when in the process is this occurring? Okay, are they in the early stages? Are they doing this before sessions, before they go into a rehab session? Or they're doing it during, or they're doing it after, right? Remember, I've mentioned in other presentations how important it is to integrate those things and have a holistic approach. Okay, so that when factor is important. So you have who, where, when, then what is the actual content of the imagery? So what specific skills are they working on? Are they just trying to cope with the challenges? Is it about the rehabilitation process itself? Okay, so we want to be as specific as we can there, because the situation's different. That's why I said at the beginning, there's no standardized approach on this. So we got to factor that in. Okay, so then the last W is the why. What is the purpose? What's the goal of the imagery? What are we trying to accomplish? Is it to execute certain skills? Is it to manage pain? Is it to build confidence? That really, really matters, and it'll help determine, where we go with the scripting. Okay, so you have the PETLEP framework, and you have the 5 W's of imagery, couple of different ways. You integrate these things, you put it together, you got a great script for your athletes. So now I want to shift and talk about mindfulness in injury rehab as the other sort of core intervention approach here. Okay, and so just as a reminder, how do we define mindfulness? It's just you're paying attention in a particular way. You're paying attention on purpose to whatever it is that's happening right now, and importantly, it's non-judgmentally. Okay, so there's those components where it's intentional. You're paying attention on purpose. There's an intentionality, but it's non-judgmental. You're just noticing, okay? You're just paying attention. You're seeing what's going on. You're not attaching good. You're not attaching bad. You're just noticing, okay? And this has become much more widespread in injury rehab, and for a good reason, because you can train your attention and cultivate awareness of the thoughts and feelings and different body sensations without attaching judgment to that, because a lot of athletes, it's just like, oh, pain, bad, right? Instead of, okay, pain, interesting, I'm noticing, what is this experience like? And they remove that judgmentalness, and then interestingly, that helps them deal with the pain or just experience it differently. Okay, so definitely being explored is a valuable approach in these types of settings to help athletes cope with the stress or different emotional challenges that they're dealing with, or like I said, the physical discomfort and pain that's associated with injury and the whole rehab process. So last thing I'll share are some more specific approaches of mindfulness. Now there's several different interventions that are based in mindfulness that have been adapted for sports contexts, including sports injury. Okay, so I'm not going to go into incredible detail on these. I'm just going to mention them to you as sort of food for thought, things that you can go and explore more. So the first is mindfulness acceptance commitment, or the MAC approach. And there's some good research and articles you can read on that and dig on specific interventions and how that's been applied. You have the mindfulness training in sport approach, MTIS, and you have mindful sport performance enhancement, MSPE. So these are all great approaches. There's more specific frameworks for these. Again, you still got to adapt them and customize them to the situation, but they give you kind of a standard starting point with some of the guidelines, which can be really, really helpful. And they're supported by research, right? Of using them in this domain with injured athletes, and there's lots of potential benefits, like I've talked about before, of helping them better adhere to their rehab program. Maybe they reduce their fear of re-injury. Their sensation of pain intensity could go down, or we're just improving their psychological well-being. Okay, all sorts of those types of things. I mean, mindfulness is really great at helping athletes, accept their current situation. And then they're managing difficult thoughts or emotions, right? They have the frustration and fear or whatever they're focusing their attention on. You can shift that and focus on the present moment, rather than them dwelling on the past injury and what happened, reliving that, or worrying about the future, which really characterizes a lot of what athletes go through. Is they're looking at the past and they're looking at the future, and they're not actually living in the moment. They want to get out of the moment and be in the future and be healthy again. Okay, and so it just speaks to the applicability of this approach and how useful it can be. Okay, so I definitely encourage you to dig more into what I shared. I talked about some basic frameworks at the beginning, and then dug a little more deeply into imagery and some possible approaches there, and how you can use that with injured athletes. And then mindfulness definitely has application here. So we really just scraped the surface, but I do hope that you benefited by listening to some of these things and thinking about this, and that if you're curious to learn more, that you go dig and you read some more things. So thanks for listening. Appreciate you being here. That's all I have. So I'll see you the next time. Take care.
Thank you for listening to this recording in the Sports Psych Lecture Series. I hope you learned something. More importantly, I hope you learned something that you can apply in your life. Feel free to share this presentation with others who might be interested. And if you're interested in more content like this, visit the Fehr Advantage channel on YouTube, or find the Fehr Advantage podcast on Spotify, or visit my website at fehradvantage.com.